Do you like it?
Are we good to go?
Yeah, yeah,
Is this mic live?
yeah.
Terrific. So I think we'll get started if everyone can take their seats. Good morning. It's my great pleasure to welcome you here today for this very special edition of our Department of Surgery University rounds, and to honor with you our great friend, mentor, leader, colleague, Robin McLeod. It's really a big pleasure to have Robin's family, her husband John, daughter Stephanie, sister-in-law Catherine, sister Peggy, here with us today, along with some very close friends, and to have many of her colleagues and friends from her long and esteemed career here with us in person in the auditorium. And I know there are many of you online as well. I'm very grateful to all of you for coming today. And I'm just delighted that Robin is here with us in person to receive this tribute. Before I move on, I want to thank the people who organized today, and that would be Natalie Coburn, Erin Kennedy, Helen McCrae, and Sylvia Perry. So can we just thank them to start with, please? So next on the order of business. Okay, there. I just want to, with you, acknowledge the land on which the University of Toronto sits and operates, and on which we work on a daily basis. It has for thousands of years been the homeland to many Indigenous peoples, including the Haudenosaunee, the Huron-Wendat, the Anishinaabe, and the Mississaugas of the Credit. And we're very privileged to work and live on this land today and share it with the Indigenous peoples across Turtle Island. Now, the beginning of the formal program, I'm very pleased to acknowledge our master of ceremonies for today's program, Zane Cohen, who is longtime surgeon-in-chief of this hospital, Mount Sinai Hospital, and also a longtime colleague of Robin's. They worked together very, very closely for decades, and I think it's very fitting that Zane head this program of tribute today. So Zane, please come up and get us going.
I was just commenting while I take my mask off for a while how short I am, actually, because you can't even see me over the podium, so I'm just standing a little bit on the side. It really, I'm very, very thankful for being included in this. It's a tremendous honor and pleasure for me to be here and look in the third row and see my colleague, friend, partner, Robin, ever since 1984, when she was hired and plucked away, actually, from the Cleveland Clinic, where she was a fellow. That's a lot of years. And I would also say, and I don't want to take up too much time from the real speakers, that we've both been around. We've both seen a lot. We've been to a lot of universities, a lot of departments of surgery. But I've never seen any two surgeons work as closely as we have in the operating room and in all aspects of surgery as Robin and I have. We were like one person. And that is what a lot of our fellows have mentioned when they think of us, that we are indistinguishable as surgeons in the operating room. She would come in if I need to leave, I would come in, she needs to leave. And what was so amazing about that was that we just took over from one another. It was like a seamless kind of relationship. So Robin, it's really, really wonderful to be able to give you this tribute, which you richly deserve. And I think that, I hope that you will enjoy what's coming up over the next 15 minutes. The first up the bat, and being first, the leadoff hitter, so to speak, I guess, is our good friend, Marcus Burnstein. Marcus is, he actually came in, I think, 1994. He was a program director of colorectal surgery in Dalhousie before he came here, head of the division when after he came to St. Mike's from 1996 to 2003, and program director of the University of Toronto residency program in colorectal surgery from 1996 to 2011. He's a member of the board of directors of the American Board of Colorectal Surgery. He's an examiner for the American Board as well. He served as the associate editor of diseases of the colon and rectum and an associate editor of the Canadian Journal of Surgery, and as president of the Canadian Society of Colon and Rectal Surgeons, as well as chair of the Royal College of Canada Specialty Committee in colon and rectal surgery. An outstanding person, really an outstanding person, a good friend. And as I was saying to someone as we were talking beforehand, he was one of only two of the funniest and most fun people that you could ever want to know. The other being Alan Gross, who's also at this hospital. So Marcus, I'm going to ask you to come up, and obviously from what I said, he is well qualified to tell you about the impact that Robin has had in the area that he has had some impact, and that is the area of education. Marcus?
As you can see, I'm a whole half-inch taller than Zane was fine. I don't really have to stand off to the side, but I'm going to do so anyway. I am not a clinical epidemiologist. I cannot do a power calculation. I cannot intelligently discuss the differences between parametric and non-parametric data. But I am a colorectal surgeon. And as a colorectal surgeon, I can tell you where Robin McLeod sits in the pantheon of academic colon and rectal surgeons. Robin McLeod sits at the very top. And my message this morning is that the reasons for Robin McLeod's preeminence have also provided the foundation for the very successful colorectal surgery educational enterprise at the University of Toronto. Now, as the first speaker, I was asked by the organizers to review Robin's biography. And I started to prepare a biography, but I have to say, tedious. I don't know, it's not up there anymore, but triumph after triumph, award after award, professorships, honorary fellowships, presidencies, ultimately, very fittingly, culminating an Officer of the Order of Canada, and I quote, for achievement and merit of a high degree, especially service to Canada and to humanity at large. Wow. It is far more interesting, in my opinion, to try to explain the Robin McLeod biography than it is to review it. Those of you who know her will agree it's absolutely impossible to explain Professor Robin McLeod, but I realized I could come close with just 2 words: Spruce Grove. Spruce Grove is the small community in Alberta where Robin was born and raised. That makes Robin McLeod a Western Canadian of Scottish descent, and that explains almost everything. Since this is clinical epidemiology rounds, and although I'm no epidemiologist, I did do a systematic review of the Western Scottish Canadian phenotype. And Professor McLeod is the prototype phenotype, the proto-phenotype, characterized by steely determination, fierce loyalty, unfailingly true to her word, every task seen to completion, every job done well, and then on to the next job. Profoundly uncomfortable with any direct praise. In fact, those of you who know her, I challenge you, just try to give her a compliment. I've been doing it for 35, 40 years, can't be done. Well, you can do it, but it will not be accepted. Could swear before she could count. And a wee dram can produce absolutely unexpected behaviors. Now, I hate to rain on the ClinEpi research and CCO parades that are about to follow, but Robin McLeod has not been sitting at the top of the colorectal surgery mountain for over 3 decades just because she can design a trial. I concede that this is a big part of her success, but an equally compelling argument can be made for Robin's acclaim that it is because she's a clinical surgeon of incomparable mastery. When Robin returned to Toronto from the Cleveland Clinic in the early 80s, word got out of Robin's staggering operative ability and her impeccable clinical judgment. And word got out of Robin's wonderful ability to transmit these skills to trainees. Robin was a resident's dream. The University of Toronto became the place to train in colon and rectal surgery. By the mid-80s, the University of Toronto had the first and for many years the only Royal College accredited colorectal surgery residency program in Canada. At the beginning, we were one of the orphan programs referred to as accreditation without certification, but we soon became a full Royal College specialty program. The Toronto program was not only Royal College accredited, we were also fully accredited by the American Board of Colon and Rectal Surgery, and we were the only program outside of the United States to have that status, and this would not have happened without Robin McLeod. The colorectal residency program has evolved over the decades, but the basic structure remains a clinical year and 1 or more enrichment or research years. The clinical year has included at least 6 months at Mount Sinai Hospital, where residents see the most challenging clinical problems in our specialty. As I think you all know, Robin Zane, along with Helen McRae, built a national and international resource for the management of the most complex diseases of the specialty, especially as they relate to Crohn's disease and ulcerative colitis. The research experience was invariably guided by Robin, and the work consistently produced presentations, publications, and awards. Robin always put the fellows front and center, always deflecting any personal credit. Research opportunities with Robin were broad, and I'm sure you're going to hear more about this. There were no limits. Important contributions were made to every aspect of colorectal surgery, as well as quality improvement, guideline development and implementation, and many other topics. I have read, not this morning, but over the past 30 years, I have read all of Robin's articles. And my favorite is this gem, produced when Helen McRae was Robin's fellow. This has been the most frequently cited article on the management of hemorrhoids since it appeared over 30 years ago. Of course, neither one of the authors has actually treated a hemorrhoid in the past 30 years, but it doesn't matter. It is a gem of an article, which I refer to frequently. Robin's research, peerless clinical skills, and devoted mentorship allowed the Toronto Colorectal Surgery Program to attract the best and the brightest trainees from North America and around the world. Robin has trained scores of clinician scientists who are now professors of surgery, department chairs, surgeons-in-chief, program directors, and thought leaders on 5 continents in over 20 countries and in every department of surgery in Canada. Her impact has been simply breathtaking. Even Robin's close colleagues look at what she has achieved, and we shake our heads in astonishment. I reached out to former fellows, and one thought repeatedly jumped out from the letters that I received. Robin is inspiring. The comments of Professor Justin Davis at Cambridge University, who trained with us about 15 years ago, are highly representative. And I quote, "Robin epitomized everything that I wanted to be as a colorectal surgeon. She was technically very skilled and was a patient and calm teacher. Family was at the heart of everything. Love of family shone through, and it was my privilege to witness this. Robin and John welcomed me and my family into their home as if one of their own." I am often asked who inspired me most during my surgical training. I have only ever given one answer to this question, and that will never change: Robin McLeod. I thought that was a nice spot to end. Thank you.
Thank you, Marcus. Brilliant as usual. The next speaker is going to talk about research, mentioned briefly by Marcus, and I can think of no one better to do that than our next speaker, who is Erin Kennedy. Erin is an associate professor in the Department of Surgery and in the Health Policy Management and Evaluation at the University of Toronto, and a member of the Surgical Oncology group at Princess Margaret Hospital and the Ontario GI Cancer Lead in Disease Pathway Management Program at Cancer Care Ontario. She has an interest as a colorectal surgeon in both oncology as well as inflammatory bowel disease, and an internationally recognized expert in patient-centered care, qualitative research methods, and shared decision-making in surgery. She has led in the development and implementation of a synoptic MRI report for rectal cancer across Ontario, and quality improvement projects focused on standardization, use of MRI, multidisciplinary cancer clinics, surgical and pathology techniques across the country. She's a recognized expert in her field. She holds many CIHR grants, and I'm going to invite her now to come to the podium to talk about the impact that she has had from Robin on research in general. Erin?
Is this, yeah. How am I going to get, oh, perfect. Yeah, it's good. Well, welcome everyone, and thank you to Carol and to Natalie for giving me the opportunity to talk today. I figured that I was going to have 2 very insurmountable tasks with this talk today. And the first task was trying to summarize Robin's research career into 10 minutes. And the second thing was having to follow Marcus Burnstein in a talk, because I think he is one of the most engaging and entertaining speakers in our department. So I wanted to start off with a quote from Marcus. I wanted to steal that from Marcus. And it's about Robin And so the quote came actually when I started the surgical scientist training program with Robin as my supervisor. And I think Marcus could tell I was a little bit stressed about it all. And so he came up to me and he said, "Don't worry, Erin, Robin's the best 5 people I've ever met." And he was right. So Robin's interest in research in clinical epidemiology started when she was an intern at the Toronto General Hospital. And at that time, all of the female staff in the operating room had to wear scrub dresses. And because they all had to wear scrub dresses, there were serious concerns about perineal fallout. And as a colorectal surgeon, a lot of disturbing images go through my mind when I think about that term. But in the context of the day, it was defined as airborne dispersion of skin bacteria caused by chafing of the bare thighs. And at the time, it was considered to increase the risk of surgical site infection, or SSI. So all of the female staff were also required to wear pantyhose in order to contain the bacteria and decrease the levels of perineal fallout. And as the story goes, Robin forgot to wear her pantyhose on a couple of occasions, and this resulted in a meeting with the surgeon-in-chief about this. Now, very fortuitously, before the meeting, Robin actually found an article in the Lancet that actually showed that pantyhose increased the level of perineal fallout and gave this to the chief of surgery. I would have liked to be a fly in the wall at that meeting, but needless to say, these were the humble and early beginnings of Robin's career, and a star was born. And as everyone knows, Robin went on to an incredibly successful and productive career as an academic surgeon, and she's internationally recognized as an expert in colorectal surgery and clinical epidemiology. And I'm really not going to be able to tell you about all of her accomplishments in this talk, but over the next couple of slides, what I really wanted to focus on is 3 really impactful and transformative contributions she made to change the way we think and the way we do research in the Department of Surgery. The first is Robin challenged us to do higher quality research, in particular randomized control trials. And she not only challenged us to do this, she proved to us that you could do it by leading several randomized control trials throughout the course of her career. And perhaps the 2 most notable ones are her single patient randomized control trial that was published in the Lancet, and the Canadian DVT trial, in which she got 900 patients to agree to have bilateral leg venograms, not only once, but twice on postoperative day 5 and 9 to rule out a DVT. Second, she really insisted that we were able to critically appraise the literature that we were contributing to. And probably several people in this room remember Monday Night Journal Club at Mount Sinai, which usually started with Robin paging all of the residents out of the OR and getting us to Journal Club, where she'd feed us wing machine chicken wings and French fries and ask us questions about a paper that most of us hadn't read. This quickly developed into citywide Journal Club. And later, this program that she developed was endorsed by the Canadian Association of General Surgeons and expanded to be called Evidence-Based Reviews in Surgery, which now has an international audience. Third, she also wanted to make sure that the research that we conducted, we actually put it into practice and put our money where our mouth was. And she did this by developing and implementing clinical guidelines, which we use across the city and across the Department of Surgery. As everybody probably knows, it started as best practice in general surgery, and it's now expanded across the Department of Surgery to become best practice in surgery. These 3 contributions have really made our Department of Surgery what it is today, and has increased the level of academic productivity at our university, and has made us one of the most productive academic surgery departments in the world. and is again one of the reasons why we're one of the top 5 global universities in terms of academic surgery. It's also the reason that Robin was named an officer of the Order of Canada for leading a movement in evidence-based surgery across Canada and around the world. Robin, your legacy is going to live in all of us that you've trained and everyone that you've worked with across the University of Toronto, across Canada, and around the world. You've made all of us better surgeons and better human beings. And in closing, I'd just like to say, from our surgical family to your family, I'd like to thank them for sharing you with us, for sharing your wife, John, for sharing your mother, Claire and Stephanie, for always welcoming us with open arms, and for helping to make all of this possible. Thank you.
Well, I thought that that was really great and very difficult to kind of summarize in a few minutes, under 10 minutes, by the way. The accomplishments that Robin has made and the influence that she has had in the direction of research all over the University of Toronto and internationally in so many different universities, and to do that and to get that across to people in a few minutes is not an easy task, but I thought you did extremely well. I was present in the perineal follow-up story, and that, when I look back at it now, we can sort of smile and laugh, but it was such a serious intrusion at the time that somebody at a very high level was making this kind of claim that even then in the late 80s, it was astonishing as you look back that this could actually have taken place. I don't want to take that story and make it the real story about Robin McLeod, but that was a very, very, very serious incident at the time, and we should not ever take that kind of thing lightly. The third speaker, third in the batting order, and usually most baseball teams will say that one of their best hitters should be in the third position, and I think it's very true of the next speaker, who's Jonathan Irish, who's going to talk, I think, a little bit about system level changes and the way that his interaction with Robin, particularly at CCO, came about, and what it meant to him, what she means to him, and what she means to all of us. So John was appointed as the chief of the Department of Surgical Oncology at the PMH and completed 16 years, completed that in 2016. He's currently professor of otolaryngology, head and neck surgery, head of the division of head and neck oncology and reconstructive surgery at the University of Toronto, and was elected president of the American Head and Neck Society for 2017 and 18. He's been a major health policy advisor and responsible for access to care, quality improvement, and healthcare funding for the surgical oncology program. Pardon me. At what was Cancer Care Ontario at the time. He's provided provincial leadership and oversight, linking volume funding to quality improvement, not an easy task. He leads a multidisciplinary team of surgeons, engineers, physicians, and nanoparticle biochemists in the development of novel nanomedicine-based contrast agents which in combination with via real-time navigation and tracking systems can create innovative solutions for minimal access surgical approaches in cancer therapy. A real star in the entire department of surgery at the University of Toronto. Jonathan, definitely we can put this back here. People will be able to see you. So come on.
Thanks, Zane. I didn't realize you can read my CV. My role will be to talk about Dr. Robin McLeod's impact on our healthcare system. And this is where her life's work as a surgeon, which translated from impacting a few thousand patients, translates to her role as a health system leader, impacting millions of lives. And this is where her background in clinical epidemiology and health services research is translated to health policy implementation and impacts profoundly our patients, not in Toronto at the university, not in Ontario, nationally, internationally. We've heard this already. And it seems every 2 or 3 years, I'm asked to speak at an event honoring Dr. Robin McLeod. I was, as Zane said, I was president of the American Head and Neck Society in 2018. And I was able to award Robin with a presidential citation recognizing her work in quality improvement. Can you imagine an otolaryngologist citing the life's work of a general surgeon? And it recognized the profound global breadth of impact that Dr. McLeod has had over the 12 years that we worked together. About a year later, I was asked to speak at a CCO event honoring her recognition as Order of Canada. Now, see the smiling face. Now, the first time I ever met Dr. Robin McLeod was on September 6th, 1991. It was in the Park Plaza Hotel. I can see the family members, maybe Robin herself, squirming uncomfortably with this story, but it's okay. I walked into the hotel room and there was Robin McLeod. You see, she was the general surgery examiner for the principles of surgery for my otolaryngology head and neck surgery Royal College Fellowship. I couldn't find a picture of Robin's face showing disdain or disappointment. This is the closest I actually could come to that. But what I felt over the next 45 minutes was an intense, uncomfortable feeling. She was tough, but she was fair. And the look at the end of the day, you can see a little bit of perhaps upturn at the end of her lips, perhaps suggesting that I might have answered one question right. But this quality, this steely determination, this commitment to excellence, this breadth of knowledge has impacted all of us over so many years. Let's go forward now from 1991 to 2003. The CCO was essentially, Cancer Care Ontario was essentially disbanded and reformed under the leadership of then CEO Alan Hudson, Terry Sullivan, Hartley Stern became the provincial head of surgical oncology. Bernie Langer became the quality lead for surgical oncology. David Urbach became the clinical lead for research. And I was asked to join the team as clinical lead for wait times and strategic funding initiatives. And boy, we were humming. We were a fantastic team, improving the quality of cancer surgery throughout the province through funding and driving performance and through improvement through data. Something, quite frankly, which had been ignored for 70 years by Cancer Care Ontario until 2003. 3 years later, as Bernie was tapering, I would say almost retiring, but I don't think that ever actually happened, Robin McLeod took over as the quality lead. And what a partnership Robin and I had over the next 12 years. We didn't lose a step. And as I think forward, over the course of the next 15 years with her experience at Cancer Care Ontario, all of the things that we've heard today were taken throughout the province and, quite frankly, nationally. Although we had started regionalization of HPB surgery in the province under Bernie's oversight, we really completed it under Robin. The implementation of thoracic surgery standards, where we reduced the number of lung cancer centers in the province from over 65 centers to now 15 centers, where we reduced 30-day mortality and pneumonectomy from 15% in before the implementation to 6% after, where we recognized that high volume centers in HPB surgery had 3 to 4% 30-day mortalities, not 14% that we saw at low volume centers. Those are real numbers. If I was to report mortality improvement of 10% with a drug, we'd be all be on the front page of the Globe and Mail and across every journal globally. And yet we did that. Robin did that. Our team did that with health services research and health policy implementation. Partnerships, collaboration. Robin did that with regards to the thoracic surgery implementation with Gail Darling, and colorectal with Aaron Kennedy. Patient-reported outcomes, Natalie Coburn. There's a common theme here. Multidisciplinary cancer conference standards, Francis Wright, where now 50,000 more patients a year get discussed at a multidisciplinary cancer conference before the implementation of those standards. There's a common theme here. Partnership, collaboration with another surgeon, and the mentorship of fellow women surgeons. Gail Darling, Natalie Coburn, Aaron Kennedy, Francis Wright, many, many others. Profound impact, not just in quality of care, but in mentorship. And then as VP, Vice President of Cancer Care Ontario, the building of our programs, not just from surgical oncology, but in all aspects, and the implementation of disease site groups, which impact the full breadth from prevention, diagnosis, to survivorship and palliative care. When she first took over as Vice President of Cancer Care Ontario, the first thing on her plate was CAR T-cell implementation and the disaster related to complex malignant hematology. A general surgeon overseeing the fact that we were sending patients south of the border for care for acute leukemia. She solved that problem. That concept of the breadth, the depth of knowledge, and she was a leader, and quite frankly, we followed. That issue or that quality of tough resiliency, commitment to excellence, high quality, and mentorship of others which we've heard already, seen at the system level and the profound effects from that. And she'd be the first. As we've already mentioned, she'd be the first to mention that she was part of a team. And I can't show the whole picture or pictures of the team at Cancer Care Ontario. Many of them have joined online today. I know over 50 are online joining us today. But on behalf of the CCO team, we thank you for your guidance. On behalf of the province of Ontario, we thank you for your commitment and service. On behalf of our patients, millions of them, we thank you for your gratitude. We thank you with gratitude. And it's already been mentioned, and probably the CCO team, we would, and Aaron mentioned this, we would like to thank and recognize the home team. This is one of my favorite pictures. John, Claire, Stephanie, thank you for giving us Dr. Robin McLeod.
Thanks very much, John. That was really a tremendous synopsis and tremendous tribute to Robin as to the impact she has had at various system levels. I do want to go back for a second. I made a mistake, a slip of the tongue, and I want to apologize to my good friend and colleague, Dr. Erin Kennedy, for calling her an associate professor, because she actually received her professorship about 6 years ago. So I am forever sorry that I made that slip of the tongue. John mentioned mentorship. Now we're going to hear from somebody who personally felt that mentorship, what that mentorship meant to her. And I'm talking about Dr. Karen Devon, who is sitting in the front row here, be up here in a moment, who's an endocrine and thyroid surgeon with an interest in medical ethics and education. She entered our own surgical training program and proceeded to be in the surgical sciences program here in Toronto, and was awarded her master's in clinical epidemiology, and then went on to do fellowship training in Chicago as a clinical fellow, and then pardon me, it's only been 5 or 6 weeks that I've had that. And a clinical ethics fellowship at that same university. She's enrolled in the Education Scholar Program at the Center for Faculty Development and Education at the University of Toronto, has initiated a book club here at the University of Toronto as well, and was one of our proud favored residents here in Toronto. So Karen, if you could come up, and we welcome you to the podium.
Perfect. Okay, thank you, Carol, for the honor and the time constraint. Don't worry, Robin, to calm my nerves, as you explicitly taught me when I was preparing for my first paper presentation in 2004, I practiced in a quiet, private space of a locked bathroom stall just down the hallway. And while I know this is supposed to be about the visionary Dr. Robin McLeod, the person who actually changed my life is Dr. Lauren Rothstein. When I was at PGY1 and he was the program director, I was meeting with him to go over my plans for my mandatory first year research project. And in his usual friendly but direct manner, when I was telling him my plans, he said, absolutely not. You are not going to do that. Karen, you are going to introduce yourself to Dr. Robin McLeod and figure out a way to have her take you under her wings.
Many years later, I was appointed as the first official surgeon ethicist in our Department of Surgery. But in truth, as was often the case, and you've heard already today, Robin was truly the first, breaking ground, making space. Forgot that I had slides. The goal of medical ethics is to improve the quality of patient care. The word ethics is derived from the Greek word ethos, which means character. Robin is driven always by her character to address the primary question of medical ethics, which is what is the right thing to do. If you qualitatively code, as I recently painstakingly did, the massive tome that is her CV, you can extract certain themes that are listed. Had to be accurate or risk her red pen, so there's a lot of couches as well and a lot of awards. The goals of medicine have long been seen as restoration of health or saving or prolonging life, beneficence or non-maleficence. But Robin, very early on, before many surgeons understood that there was more to being a surgeon. We could relieve symptoms, we could restore function, including in areas that other people were afraid to go, like sexual function. We could and must educate patients and others, which required asking them and trusting them, but creating decision aids to guide them. In other words, giving patients autonomy. And when the opportunity to speak to large groups, when given the opportunity to speak to large groups, her guiding ethical lens is clear by what she chooses to address. A few examples. Is this ethical? Money, fame, and conflict of interest at the American Society of Colon and Rectal Surgeons. Doing what's best for the individual patient. The presidential address for the Canadian Surgery Forum in Vancouver. And just when you think she might retire, you get another email from her about her latest ethical focus as she dedicates herself to the Green OR initiative to literally ensure that our conduct as a larger surgical community is not only focused on individual patients, but towards preserving the future health of our planet. I asked a few people who have made an appearance in her CV biography to tell me about the specific impact of her life's work has made on them and what they learned from her. Many, of course, felt that not only had she contributed, but she had defined their career or even inspired them to enter healthcare in the first place, such as Emily Pearsall, who had a degree in human rights ethics before embarking on a career-making journey with Robin. Many focused on her genuine passion for evidence and real change, her directness, humility, and how much fun it always was, unless, of course, you forgot to check the stoma on rounds. Not all the people greatly influenced were physicians or patients, but nurses, administrative assistants, and cleaning staff, a testament to her belief and commitment to the final pillar of medical ethics, equality and justice. Dr. Andy Smith wrote me such a long, effusive, positive testimony that I almost offered him my part of this talk. She was the first person who gave him surgical confidence. I will share a few comments here. Dr. Nancy Baxter said, "It's hard to sum up, but there's a lot of truth to the statement. You have to see it to be it." And for many of us, Robin was really it. Fantastic researcher, terrific clinician, and led the way for an entire cohort of clinical researchers in surgery, women and men. I've always wondered how Robin managed this. She was forging the path, and I'm sure that was not without facing unnecessary obstacles and hardship and required substantial sacrifice, yet that was never on the table for discussion. Her own work and the work of those she inspired is her continued living legacy. Dr. Karen Brazel. Robin introduced me to a wider group of clinical epidemiologists, and though I was much less well-trained, made me feel an equal part. It taught me a lot about leadership, as well as how group work includes people with a variety of different strengths, and the whole is always better than the individual participant. She also taught me and gave the surgical community a better way to teach and learn clinical epidemiology. Dr. David Urbach. I cannot see how I could have found an identity as an academic surgeon without Robin's influence. Robin connected me with leading international health services researchers early in my career. I learned from Robin that the key question is often not what is the correct answer, but how would we know what the correct answer is if we wanted to? Robin focused on the big picture questions. She didn't pick apart statistical flaws or focus on details. She wanted to find answers to the really big questions, and she led large-scale studies to address them. She always pursued research that could actually change practice and had a real impact. And Dr. Alan Detsky told me about when Bernie Langer, of blessed memory, was chair of surgery. He had the foresight to understand that clinical epidemiology was going to become a foundational research activity for all clinical disciplines. He realized that surgeons would need to step up their game with more rigorous methods. Therefore, he began by doing the hard work, building expertise in surgery from the ground up. Robin was one of the first people he enticed to join the small group of clinical epidemiologists at U of T, who developed their own masters in clinical epidemiology. From there, they all trained a large group of clinicians in each department. He says people like David Urbach, Nancy Baxter, and Aaron Kennedy, who then went on to train the next generation, all got their start with Robin, from one generation to the next. The Department of Surgery at U of T grew in this way, and it all started with Dr. Robin McLeod, a wonderful legacy. Robin, you sparked my own career with many chats over Diet Coke about surgical ethics, not ending with tears over some special patients and life cycle events. Then introducing me to the mentor who would guide me in the next part of my career, who you had met while chair of the ethics committee at the American College of Surgeons. And then recently recommended my appointment to the CCO board of directors and as an ethics advisor to Ministry Surgical Task Force for COVID, always keeping ethics at the forefront. It almost seemed like you had me trained in ethics so I could come back and help you. This proves that after almost 20 years since we first met on the 14th floor of this building, I have never left my perch tucked firmly under your wings, and I never plan to. There are too many praises to sing, memories to share, and thank yous to express, but I know that I do so not only for myself, but for countless others around the world who became part of your family. Thank you, and we love you.
Thank you for that, Aaron. That was heartwarming. And you can tell, certainly from your words, what it really meant to you. And you weren't nervous at all. You sounded great. So no problem. That concludes a wonderful set of speakers, which gives you a small insight, but a good one, into what Robin has meant to her patients, as John said, to research at the University of Toronto, to mentorship there, and her impact not only here, but truly internationally around the world. I want to thank Natalie. Are you still up there? No. Yep. For, I believe, this idea of a tribute to, hope I'm not making another mistake, Carol. You are, okay. Well, then I won't pick out an individual. I'll just say I want to thank Carol and Natalie, Helen, everyone who's involved for thinking of this as a grand round and for implementing it. It was a wonderful, wonderful tribute. So now I am going to call on the opener, who is now the closer. It's very unusual for the same person in baseball to be the opener and the closer, but here we are, and I'm giving the microphone back to Carol.
Thank you, Zane. So in concluding, I want to thank a few of the people who came here to this in-person audience today. Just acknowledge Richard Resnick, Marie Rudka, and also Stan Feinberg for being here, Lisa Satterthwaite and Shannon Spencer. There were some people who heard about this and basically insisted that they come because they felt so strongly about what Robin has done for all of us. And so thank you for being here. I also want to thank our OR nurses for coming out this morning. And our surgical house staff here at Mount Sinai. Your presence is definitely a testament to Robin's power and inspiration and legacy. And then I want to thank our 4 speakers. I don't know if you could tell that this was a high stakes occasion for all 4 of them. We're very practiced speakers. And I think they felt so much emotion in their delivery, and they prepared so well. They really wanted this to get across to you who are here what Robin has done and accomplished in her life. So I'm just delighted they were all here to provide this tribute. And finally, thank you, Zane, for your very gracious MC work this morning. We all appreciate it. So we have a little plaque to give to Robin, and I don't think you're going to be able to see this on the camera, so I'm just going to tell you. Erin, could you just? Thanks. This is an acknowledgement of today's program, and with this beautiful photograph of Robin smiling her big smile, John, not her smile of approbation, but this one. And we're going to present this to Robin and John as we close the program. So thank you again, everyone, for being here today, and thank you, Robin.